I'm starting, okay? Definition, but well, osteomyelitis is infection in the bone. Osteomyelitis can occur in infants, children, and adults. Different types of bacteria typically affect the different age groups. In children, osteomyelitis most commonly occurs at the ends of the long bones of the arms and legs, affecting the hips, necks, shoulders, and wrists. In adults, it is more common in the bones of the spine, feet, or in the pelvis.
In this video, we will study the pathological features of osteomyelitis. Now, based on morphology, we divide the osteomyelitis into two main categories that are acute osteomyelitis and chronic osteomyelitis. Acute osteomyelitis is the acute infection of bone and bone marrow, whereas if this infection is not recovered and becomes chronic, we call it as chronic osteomyelitis. Now, in this video, we will be discussing the morphology of acute osteomyelitis, and then at the end, we will briefly see the additional features in chronic osteomyelitis. Now, in the morphology of acute osteomyelitis, there are four main features that follow a sequence. Firstly, you know that whenever there is an acute infection, you will see acute inflammatory cells that are neutrophils, and you can see here in this bone there is neutrophilic infiltration. And sometimes these infectious bacteria and the defending neutrophils also spread to the subperiosteal regions of the bone. And if this happens, it results in pus in the subperiosteal region, which is called periosteal abscess or subperiosteal abscess. So in the phase of acute inflammation, you see neutrophilic infiltrates in bone and you see subperiosteal abscess. Now, during the destruction caused by bacteria and attacking neutrophils, a part of bone becomes dead and necrotic. This piece of dead and necrotic bone is called sequestrum. So what is sequestrum? Sequestrum is a dead piece of necrotic bone. Now, after the acute inflammation phase is over, there is onset of chronic inflammation. And this chronic inflammation is characterized by chronic inflammatory cells that are lymphocytes and macrophages. And at last, when the infection is fully recovered, the process of repair starts. And in the process of repair, the osteoclasts degrade the infected bone, and in the place of this degraded infected bone, there is growth of fibrovascular tissue. And along with this, there is reactive formation of bone in the periphery of this fibrovascular tissue. So you can see here in this diagram that the central area is fibrovascular tissue and it is surrounded by reactive bone formation. So overall, in acute osteomyelitis, firstly you see acute inflammation, then you see sequestrum, which is a piece of necrotic bone, then you see chronic inflammatory cells that are lymphocytes and macrophages, and at last in the repair process you see central fibrovascular core surrounded by reactive bony formation. Now, if this infection of bone and bone marrow persists for a very long period of time, then it is called chronic osteomyelitis. And in chronic osteomyelitis, there is only one difference that you need to remember, that in chronic osteomyelitis, the dead piece of necrotic bone or sequestrum persists. But surrounding the sequestrum, there is reactive bony formation just like this. And this reactive bony formation that surrounds the sequestrum is called involucrum. So what is involucrum? Involucrum is a reactive bony formation that surrounds the sequestrum in cases of chronic osteomyelitis. So these are the morphological features of acute and chronic osteomyelitis. Hope this concept is clear to you now.
Okay, continue, but application in medicine, when osteomyelitis is diagnosed, it is classified as acute if the duration of the illness has been less than 2 weeks, subacute for a duration of 2 weeks to 3 months, and chronic for a longer duration. Since any bone can be affected, patients can be present with a wide variety of symptoms and signs. Since any bone can be affected, the wide variety of symptoms and signs in all the patients with the pathology.
It's a condition that can strike an otherwise healthy child, but knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria. It not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems a little bit more likely to exit in these areas. The knee, in a skeletally immature patient, is affected in over 50% of spontaneous acute hematogenously spread osteomyelitis.
As Dr. Wagner explains, the bacteria can spread dramatically.
Once it has established itself within the bone itself actually has a network of what's called Haversian canals that allows cells within the bone to communicate with each other. The bacteria can then use that to communicate.
That's when children start to show symptoms.
Probably one of the most common is pain in an extremity, limp, especially in young children where they can't tell you, "Mommy, it hurts here." You will see them favoring one leg. Certainly there can be swelling, there can be redness over the area, and fever. These are some of the more common symptoms.
These symptoms should not be ignored. Osteomyelitis can be treated with antibiotics. For those with more severe cases, surgery may be in order. Reporting for Lee Memorial Health System, I'm John Bafar. Infants can also be affected. The infection can spread to the joint and cause arthritis.
Pros and cons. Pros. Determining the causative organism is vital. Osteomyelitis can be diagnosed by means of imaging, but it is essential whenever possible to obtain a sample for the antibiogram that might disclose problematic agents such as SARS. Cons. Late diagnosis or misdiagnosis.
Health tips for every day, for everyone. From Dr. Mims.
ഹലോ ഡോക്ടർ മിംസ് അല്ലേ?
അതെ, ആരാണ്? ഡോക്ടർ, ഞാൻ സിദ്ധാർത്ഥാണ്. എനിക്ക് താങ്കളോട് ഒരു സംശയം ചോദിക്കാനുണ്ടായിരുന്നു.
ചോദിച്ചോളൂ സിദ്ധാർത്ഥ്. ഡോക്ടർ, എന്റെ മകന് കാലിലെ തൊടയുടെ ഭാഗത്ത് ചുവന്ന നിറവും അസഹ്യമായ വേദനയുണ്ട്. അവൻ ആരെയും തൊടാൻ തന്നെ സമ്മതിക്കുന്നില്ല. കാലുകൾ അനക്കാനും ബുദ്ധിമുട്ടുണ്ട്. ഇത് എന്തുകൊണ്ടായിരിക്കും ഡോക്ടർ? മകൻ എത്ര വയസ്സായി?
അവനിപ്പോ 1.5 വയസ്സായി. സിദ്ധാർത്ഥ്, ഇത് കേട്ടിട്ട് അക്യൂട്ട് ഓസ്റ്റിയോമൈലൈറ്റിക്സ് എന്ന അസുഖമാവാനാണ് സാധ്യത.
അതായത് കുട്ടികളിലെ അസ്ഥികളിലേക്ക് രക്തത്തിൽ തന്നെ ഉണ്ടാകുന്ന അണുക്കൾ കടന്നുണ്ടാവുന്ന അണുബാധയാണിത്. ഡോക്ടർ, എന്താണ് ഇതിന് കാരണം? ഇത് പ്രധാനമായും പ്രസവ സമയത്ത് അമ്മയുടെ ഗർഭപാത്ര സംബന്ധമായുണ്ടാവുന്ന അണുക്കൾ കുട്ടിയിലേക്ക് പകരുന്നതാണ്.
Issue of playing equator. Osteomyelitis has such helps two types of treatment, antibiotics and surgery. The latter is only used when the disease is very serious or chronic. This disease is usually very aggressive and can generate a lot of pain. Its diagnostic process is very varied and ranges from a simple laboratory test to nuclear medicine. To be detected in time, the healing process with the appropriate treatment is total.
വെൽക്കം ഓൾ ടു യുവർ ഷോ ഡോക്ടർ ആസ്റ്റർ. ഇന്ന് ഞാൻ ചർച്ച ചെയ്യുന്നത് അക്യൂട്ട് ഓസ്റ്റിയോമൈലിറ്റിക്സിനെ കുറിച്ചാണ്. കുട്ടികളിലെ അസ്ഥികളിലേക്ക് രക്തത്തിൽ തന്നെയുള്ള അണുക്കൾ കടന്നുണ്ടാകുന്ന അണുബാധയാണിത്. പ്രത്യേകിച്ചും 2 വയസ്സുവരെ പ്രായമുള്ള കുട്ടികളിലാണ് ഇത് കണ്ടുവരുന്നത്. അണുബാധയുള്ള കുട്ടികൾ കൈകളോ കാലുകളോ അനക്കുകയില്ല. ആ ഭാഗങ്ങളിൽ ചുവന്ന നിറവും തൊടുമ്പോൾ വേദനയും ഉണ്ടാകും. ഇത് പ്രധാനമായും കണ്ടുവരുന്നത് തുടയെല്ലിലും കൈകളുടെ മുകളിലുള്ള ഹ്യൂമറസ് എന്ന അസ്ഥിയിലും തുടയെല്ലിന് താഴെയുള്ള ടിബിയ എന്ന അസ്ഥിയിലുമാണ്. പ്രസവ സമയത്ത് അമ്മയുടെ ഗർഭപാത്ര സംബന്ധമായി ഉണ്ടാകുന്ന അണുക്കൾ കുട്ടിയിലേക്ക് പകരുന്നതാണ് നന്നേ ചെറിയ കുട്ടികളിൽ ഇത് വരാനുള്ള കാരണം. അല്പം കൂടി പ്രായമായ കുട്ടികളിൽ പ്രതിരോധശേഷി കുറവായതും ശ്വാസകോശത്തിലെ അണുബാധ അസ്ഥിയിലേക്ക് പടരുന്നതും ഇത് വരാനിടയാകും. തൊലിപ്പുറത്തുണ്ടാകുന്ന ഒരു ചെറിയ കുരുവിൽ നിന്ന് പോലും അണുബാധ അസ്ഥിയിലേക്ക് പടരും. ഇത് അക്യൂട്ട് ഓസ്റ്റിയോമൈലിറ്റിക്സ് വരാൻ കാരണമാവുകയും ചെയ്യും. MRI സ്കാനിങ്ങിലൂടെ എത്രയും നേരത്തെ രോഗം വ്യക്തമാകും. See you tomorrow at the same time. Thank you.
In conclusion, acute osteomyelitis presents different characteristics in the neonatal and postnatal periods. Bone scan and RII both have a high sensitivity in detection process. And bacteriology is positive in 15% of cases.
We will be talking about pathogenesis of osteomyelitis. The possible routes of infection can be either hematogenous from septic focus like a boil or a sore throat, or it can follow direct inoculation from an open fracture or a surgery. It can also spread from the infection of the adjacent sites like odontogenic infections leading to the osteomyelitis of the jaw. Edema and pus formation from acute inflammation leads to significant rise in the intramedullary pressure. This leads to vascular collapse resulting in ischemic necrosis of the bone. The pressurized focus of infection can also force its way to the bone cortex and ultimately under the periosteum, which can separate it from the underlying bone, leading to further compromise of the bone's vascular supply, contributing to bone ischemic necrosis. Particularly in children where bone and periosteum are loosely adhered, the infection can generate subperiosteal abscesses or spread along subperiosteal planes into adjacent joints.